Today I am going to talk with doctors Jim Hamilton and Zachary Hamilton from the Department of Doing Good. Hello, gentlemen.
Hi.
Hi, how are you, Doc?
Good, good. So let me start by just asking you, can you tell us a little bit about who you are and how does this organization fit into Alaska's healthcare system?
Well, yeah, I'd be glad to go first. By the way, thanks for having us on the webinar, and we always appreciate it. Appreciate working with AppleChat, you and Adam. So I'm glad to be here with you.
Likewise.
Well, I'm Jim Hamilton. I've been in and out of Alaska for over 40 years now, and lived here 3 different times. Been back for the last 9+ years here, and have a couple of businesses. Zach and I are in business together. He's not just my son, but we're in business together and have a couple of businesses. One of them is Department of Doing Goode, and it's a consulting coaching business. So I'm an executive coach, business coach, that kind of stuff, and organizational consultant. And we're a global organization here in Alaska. It's kind of where we're stationed out of. So we work around the world, but we are consumed with doing something with great impact here where we live in our own state here in Alaska.
Yeah,
Great.
absolutely. I'll just jump in. Our vision, for our organization is increasing the world's capacity to do good better. And it's not just a slogan, but it's really the design principle that we build into everything that we do. And part of my background is I'm a U.S. Air Force veteran. I've been involved in prison reform and reentry programs for the last 15 years in different complexes in Texas Department of Corrections in Michigan, and also here in Alaska where we're based now. And have been involved in starting some sober living homes and built a track record over the last 20 years since I left the military of just providing presence, a steady presence in hard places where there are people and organizations that others maybe have given up on. And so in some ways, if I were to have one job title, it might be consultant or a transition management specialist would be an area of expertise for me.
Yeah.
All right. Outstanding. And what about this particular application for the RHTP funds in Alaska? What kind of projects are you currently looking to fund?
Well, I mean, we're always thinking about transformation. That's kind of our heart, is how do we create transformation in people, communities, etc. So when this, rural health transformation program came out, man, I was really excited because I saw an opportunity to do something that I have a great passion for, and that is to do something to help people in our rural communities, really our tribal communities. They're a lot different than rural communities are. And Zach has brother and sisters who are Alaska Native. So we have kids in their 30s who are Alaska Native. We've been entrenched in Alaska Native culture all of our lives, and as well as in the lower 48 with Indian reservations there that were under my preview as an executive director of an organization. So we saw an opportunity to get involved with an initiative in behavioral health to be able to think about how do we help young people, young adults, and families with suicide prevention, SUD, and so that's what we're doing. That's what our initiative is about here in Alaska.
Yeah, it's really a community transformation model that we want to introduce specifically in the Northwest Arctic Borough. And we're bringing our full toolkit to this grant program. And it's not just a service delivery contract, but it's this model that we want to introduce. And it involves asset-based community development principles and practices. Our expertise in capacity building as an organization and as consultants, design thinking, and really applying that to the Alaska Native youth behavioral health needs that exist all across the state, but starting with the Northwest Arctic Borough. And that organizational design that we're seeking to introduce, involves like a peer workforce, elder governance, technology, clinical support, and really bringing a self-sustaining system, not a dependency model that often is applied particularly in rural contexts across Alaska.
So one of the things I've done is talk to providers throughout Alaska, right, as part of this process, and behavioral health issues keep coming up. So it seems to be a huge issue in Alaska. What this project you're tackling, like how big of an issue is it in Alaska? It sounds like it's more so than maybe other states.
Well, it is. I mean, my goodness, the suicide rates among our young people are around 6 times more than the lower 48. In fact, just in the Kotzebue region, which is kind of the region that we would begin in, it would astound you, even among all of our tribal communities and regions across Alaska, Kotzebue would be the top for suicide rates in that area, in that particular region. You're talking about, people who are thinking about suicide. The ideation, the attempts, the deaths. We're talking about people with lifetime suicide attempts, and we're talking about especially our youth for SUD, dealing with SUD, the whole substance use issue is huge. And so it's almost 50% of the people who are looking at substance abuse are experiencing suicide thoughts across Alaska.
Wow.
Yeah,
Okay.
a lot of the programs, that have been designed over the years to try to address these types of needs, like Jim's articulating, oftentimes they're culturally disconnected, and not on purpose, but they're just programs that have been designed outside of the communities and not from within them. And so these clinical models, they sort of are imposed upon Indigenous communities. And they're clinically dependent. A lot of the programs that have been designed, they rely on licensed providers who can't reach remote villages consistently. And that's a issue that's unique in Alaska because of just the massive geography that is Alaska. And so there's a lot of long wait times, there's high turnover, and that undermines trust over time. And another thing that's often missing is just the technology gap that exists here in Alaska that maybe isn't as felt across other parts of the United States. But there's no real low bandwidth offline capable platforms that are built for this region that is Alaska, and particularly the rural communities. And so, the existing digital tools, they assume that there's broadband access that really just doesn't exist across the state. So, we're coming at this problem that is recognized and has been addressed, or at least attempted to be addressed in lots of different ways, from the premise and the assumption that, Alaska youth and, Indigenous communities across Alaska, they don't need just another outside program. They need to be shown how to take ownership of their own healing, particularly in these areas around suicide prevention.
Yeah, one of the things that I've learned from Jim, and that several other people have also said, which was interesting, is that you have to be able to coordinate the care specific to each tribal entity, each community, which was interesting, and that it sounds like it's a different approach for each region. Is that correct?
Well, it is. I mean, we have, some would say more, and you could say more, but we have at least 6 regions who have different kinds of cultures among our tribal villages and our tribal people. I mean, our kids are Athabascan, so they're different than the region in Kotzebue, obviously. And so you have, different cultural norms. Um, it is a lot different, and not just cultural, but context. You know, you're going to have a wood burner up in Kotzebue. Well, there's not many trees around Kotzebue. So, where somebody else in a tribal village might have access to a different kind of land and lots of trees for wood burning. So there's a lot of differences all across Alaska in culture, context, and people.
Yeah, and that's one of the things that struck me about your. So now it sounds like though you've already have a good understanding of how to tackle these behavioral health issues, but more importantly, from my conversations with you, which makes your program application stand out, is that you know how to coordinate this care with these communities. Because you can have a great plan, but if you can't coordinate it specific to each of these areas, I don't know, like you said, I think before, right? A cookie cutter approach won't work.
Yeah, it
Absolutely.
won't. And I think that's often what we see with government grants, federal grants, is a cookie cutter approach. And we want to look and discover what the gaps are. We believe we've done that. We want to be able to give a relational approach, a holistic approach to help fill in some of those gaps. I mean, certainly evidence-based clinical treatment is good. There's nothing wrong with that kind of behavioral health, but there's so much more that can be relational, can come from healing, can come from community. There have been some studies done by Alaska Native groups. One I'm trying to recall about 15 years ago that talks about how when youth get involved with their culture and they get involved with elders and other people at a relational level, then it really helps them in with SUD. It helps them with thinking about suicide, and it grounds them when they're grounded in their culture. And so there's a lot that we can learn from our Native communities, our elders in those communities, our those who are influencers, decision makers there who've been there a long time. I think there's a better way, a more preventative, caring, relational, holistic way, and I think that's what we bring to the table.
Now, the funds, if you're awarded this, how will you use the money then to implement these ideas?
Well, I mean, we obviously you can't do that without hiring people, and we want boots on the ground. We also, have 4 or 5 different components that will cost money. Everything from putting peer recovery people on the ground, helping operate in the school system, the justice system, and in every other area in a community is really important. So the workforce part of this program will be really important. The tech side is going to be important. That's what we've been missing for a long time. Now with telehealth, we've got telehealth partners. We've got partners lined up for training for peer recovery. So our money will be spent on all the programming to bring what we bring to the table to help cut the suicide rates down, deal with SUD in our villages, and help families. I mean, I can't imagine why we haven't done some of this in the past before now, but the tech-enabled coaching apps, some of those things are going to be a real asset.
So it sounds like this is going to well, I hate to use your phrase, do a lot of good, but so it does. But are there, and you have a great plan, are there any sort of partnerships that you would be looking for that if this goes through, that can help you fulfill this goal of yours?
Yeah, I mean, we're always looking for who is in that community. So just assessing who is in that community and who relates to the initiative that we have in behavioral health, and how do we bring a collaborative effort together. So we do have some partners in telehealth with, that offer some clinical help like counseling, therapy, those kinds of things. And we already have some education partners, a couple of those ready. One in the Kotzebue area, one here in the Kenai area as well. And both of those really cater to Alaska Native students. So we already have some partners at the table. What we're developing now are more like, a good example would be Manilik in Kotzebue. They're a huge player in behavioral health. They have a behavioral health area as part of them in their hospital. And I'll be in Kotzebue at the end of this month and hopefully talking to somebody in Manilik in that about how do we come alongside and help, and would you like to do that? So some of these partnerships that we have are developing, and some of them we have in place. We could start tomorrow. We have an implementation plan. We have everything except the funds to get started.
So if somebody is watching this and they have a community that they feel like this could benefit, or they want to talk with you about partnering because they see a similar alignment, what is the best resource? Like, where do they go to look up your information, and how would they go about reaching out to you?
Well,
Yeah, the best way would be to
go ahead, Zach.
best way to reach out would be just sending us an email at hello@departmentofdoinggoode.com. And another email address would be directly to Jim or myself. It's just jim@departmentofdoinggoode.com, or Zach, Z-A-C-H, @departmentofdoinggoode.com. We would be happy to have a conversation with individuals or organizations, or individuals representing organizations who are also interested in addressing these types of issues across our state of Alaska.
Perfect.
Yeah, we
All right.
have a web view too, Doc. We have a web view that we can send somebody who's interested that gives a summary of this initiative on it, the 4 components, etc. And there's some other collateral that we can send somebody who might be interested.
Okay, well, good. Well, I encourage anybody who's watching then who's feels like this may be a good alignment with them to go ahead and reach out to the emails, and then you all can correspond and give them the additional information. So, all right, guys, it's a pleasure having you.
Appreciate
Yeah,
it.
thank you.
So
We
much.
appreciate the questions and your interest.
All right. Thanks, guys.